This is a great opportunity, a great partnership brought to us with Governor DeSantis, the National Guard, the Memorial Healthcare System leaders. It's a unique partnership that we're bringing here to start testing larger number of individuals in the community here in South Florida. We've been challenged, like a lot of organizations at Memorial, to identify those patients that we can offer testing to. But now, in the interest of really solid public health, we want to be able to bring testing to more and more people. I want to thank a few people who are up here today. Some of the physicians that you see from Memorial, if it wasn't for their daily hard work, really in the front lines of this crisis, we wouldn't have the bandwidth at Memorial to partner with the state in this endeavor. So I just want to introduce a few people. We've got Dr. Ari Sorelli. He's our Chief of Critical Care Medicine for the healthcare system. We have Denise Reynolds, who she is the Chief Nursing Officer at Memorial Hospital West, right across the road. Jennifer Goldman is the Medical Director for Memorial Primary Care Centers, and she's going to be integral to operations here in the testing center when it gets up and running. We have Dr. Paula Eckert. She is the Chief of Infectious Disease Medicine for the healthcare system. Paula has been working tirelessly, fielding phone calls, evaluating patients, making key clinical decisions on a daily basis. Rachel Garan is a new member to our team. She's the Director of Epidemiology and Infection Control with the healthcare system, again, working very closely with the rest of us on educating the public, educating our staff, training all of us to meet these challenges. I don't think that is the Memorial Group. I want to personally thank Dr. DeSantis. I'm going to give him an honorary medical degree.
No. Don't worry, you're safe coming here. I'm not going to have anything to do.
Thank Governor DeSantis. It's really this vision, forward-thinking leadership, and really the ability to get his team and the Guard mobilized quickly to meet this challenge. And I really can't thank you enough, sir.
Great. Well, thanks so much. I really appreciate everybody at Memorial for all they're doing. We in the state of Florida, the most recent snapshot states up to 390 cases of positive COVID-19. 98 of those are in Broward County and 86 of those are in Miami-Dade. And so that's almost half of the total cases in Florida are in Broward and Dade, and obviously Broward disproportionately to Dade, has more given the differences in population. So I told Jared, as soon as all this stuff with the testing, when we were trying to figure out, are we getting the kits sent or not, I was like, look, we just got to do this ourselves. So he went out and procured 2,500 test kits on the private market. Those have been distributed across the state to hospitals, private labs, and the state county Department of Health offices. But as I found out on this, the test kit's not enough. You need to have enough swabs. You need to have enough positive, negative controls. If you run your own lab, you got to have enough of the reagent. And so through his efforts and persistence, we have test kits here for the hospital. We have 4,000 collection swabs to start right here. So that's quite a bit of samples that they'll be able to collect here and then send off. I think initially, it's important that people understand and are able to temper their expectations. We're right now living through the biggest crunch in demand for various medical supplies that we've ever seen in our country's history. I came in, I saw the folks in these N95 masks. I'm having dreams about N95 masks because it's like that's all people are talking about. They're talking about these swabs. Everybody really in the world is trying to procure this stuff. We are getting more in, and we're hopeful that we can get even more in at higher levels in the near future. But that's just the reality we have. And so what you're going to end up seeing here is initially when you come and get swabbed, they're going to save the samples, and then they're going to ship it to a private lab. And the lab's going to test it. It's not going to be done overnight. There's a national backlog. We think they're going to move to more higher throughput testing, so that potentially could speed it back up. But I just want people to understand the lay of the land here and the options. I think the great thing about the Memorial partnership is that they have their own CLIA certified lab. They're working on getting that ready. And so as this program gets going over the next couple days, hopefully what will end up happening is the people that get swabbed here, they'll just take the swabs, bring it right over to their lab at the hospital, run all the samples through. They'll probably be able to do several hundred a day, and then get people the results back quicker. Because I know people get tested and then they're waiting for the results. It's a very frustrating thing. When we first started this, we had to send everything to the Center for Disease Control in Atlanta, and it was taking a week to get the test results back. And people were understandably very frustrated about that. So this is a first step, and we just want people to understand expectations. The goal is that if this is successful, you can expand and then replicate this in other parts of the state. We right now have, the federal government has airdropped or delivered a full testing center supplies to Jacksonville, and they've done partial for Miami-Dade and Orlando. And so once we get those, that'll be the swabs, that'll be everything you need. You know, we're going to be looked to doing something in Miami-Dade County as well as Duval and Orange counties, and that obviously will be very helpful. It's important for folks to know that because the resources are still limited, this initially is going to focus on two main groups of people. Those who are healthcare workers, because if they test positive, then that could potentially sideline a lot of the people that they're working with. And so that's something that we're very, very concerned about. We want to make sure that they can get tested immediately. And then the other group that is going to be the focus will be those senior citizens, 65 and over, who are symptomatic of having coronavirus. So you need to bring your ID, and the people who will meet the test, the conditions are, if you're 65 or older, if you're symptomatic, if you've been on a cruise or affected area, if you're immunocompromised, that's the group that's going to be the focus on to start. So just understand that. I do not want to have someone wait in line for 3 hours and just to figure out that they're 40 years old, and that's not where we're going on this yet. Now, my hope is as we get more supplies, we'll be able to expand the ranges for this drive-through testing, because I think one of the big issues that we're facing is we have a number of people who are probably very mildly symptomatic. Some hardly have any symptoms. In what extent are they carrying the virus and then transmitting the virus? And the only way to do that is to really cast a broader net on the testing. So that's the goal of where we'd like to be, as soon as possible. That's why we're ordering 500,000 swabs. That's why we're asking HHS to deliver us more swabs. That's why we're doing all this stuff, because we do think it's important. But tomorrow's opening is not going to be there yet. And the goal is to get there. Now, there's logistics about the park. This is drive-through only. It's not going to be able to assist pedestrians or bikers to enter. You just have to be in a vehicle, and just know that going in. There will likely be a line of people to get in, and so you'll be winding around this park. They can go through each car, I think, in about 8 minutes is what you guys said? Yeah. So about 8 minutes. So that's very quick and good, but this, you back that up with and they have multiple lanes, but when you back that up, that is just going to take some time, so people should just be aware with that. But once you arrive to the testing area, a medic wearing a Tyvek suit will collect a sample with the swab of the nostril. Another service member will be responsible for scribbing the information from the patient's placard to the biohazard bag, and another will be responsible for collecting the sample and placing it in the bag. So that's the process that they're going to go through. They'll refrigerate the sample, and as I said initially, they're going to send it to a vendor because they have the testing capacity. Once the lab here locally is up and running, then they're going to hopefully just be able to send it through there on the same day. But we're not there yet on this. So I want to thank everyone who's been a part of this. I want to thank the Guard. If this is something that that is successful, it not only will help the folks here in Broward County, it could help folks all over the state as this is replicated. People have tried to do this throughout the country. It hasn't always worked. And so I think that they've done a good job of having a good system and then setting the expectation so people know this is one part of it. We still got more to go, but we definitely are looking for those groups of individuals who are either healthcare workers or people who are 65 and plus and are symptomatic. So that's what we hope to accomplish. And you know, I'm really happy that that this was stood up. I mean, from the time I asked Jared and the Guard to do it, you know, they've been able to put this together in relatively short order, and this is not an easy thing to do. So hats off to them for their service. Thank the medical professionals here at Memorial for what they're doing, and you know, we're all in this together. Broward County right now in Florida is the epicenter of what we're seeing, so we need to be here for our friends in Broward and turn the tide on this thing. Once we get more data with all the testing and we can expand that, that's going to help, I think, people make better policy decisions about what we're doing in terms of closing this, closing that. Right now, people